Hi, my name is Larissa Weir, and my topic is nurse-to-patient ratio. Throughout the semester, I have conducted interviews, read research articles, and found current events locally and globally on my topic. So, what is nurse-to-patient ratio? It is the ratio of nurses on a particular floor or unit to the number of patients varies everywhere. It also has to deal with acuity, and acuity means how much attention a patient needs with care. So the increased acuity of care just means more attention is needed from the nurse. So the higher the acuity, the lower ratio between nurses to patients. So for example, in a intensive care unit, with higher acuity, you're only going to have one nurse to two patients, compared to a medical surgical floor, which is the patients have less acuity, it's going to be one nurse to five patients, and so forth and so on. Next, the problem with nurse to patient ratio is the staffing. Staffing is the biggest issue. There are less nurses to care for more ill people. The nursing shortage and mandatory overtime. There's not as many nurses as there are ill people. People call out because of personal or sick reasons, which then leads to the floor being short, and then there's not enough nurses to care for the patients. Patients are at risk for poor outcomes and safety. Some examples that patients are at risk for is catheter association, urinary tract infections, falls, pressure sores, restraints, pain management, untreated illnesses, and this all leads to a longer hospital stay and then an increase of costs. As well as patients are having issues from the staff, nurses are also at risk for burnout. And because of burnout, they are overworked, they're working longer hours than the 12 that they're assigned to. Because they're rushing, there's limited time with patients, they're feeling stress, which then also leads to med errors. Next we have is that the staffing needs to be changed for to see a difference. Patients' care and safety suffers when nurses have too many patients. When there are increased patients, the time spent with the patients is decreased. Some patients may see the nurse for an hour in a 12-hour shift, while some patients who need more time with the care only will see the nurse longer. Because of that, though, there's increased risk of patient falls and other safety issues. So decreasing the amount of patients a nurse has to care for during a shift provides a wide range of benefits to both sides. You're improving patient care and safety. Staffing ratios impact the patient experience, care quality, and care access. With that being said, it decreases the patient's readmission rate and the length of stay in the hospital. Nurses also don't feel overwhelmed anymore. They won't feel rushed while doing the care for their patients. They'll spend more time with them, decreased errors on the nursing diagnosis, untreated illnesses, the decreased amount of med errors, and there will be increase with care. With that, they will be able to prioritize their work more efficiently. Next, throughout this process, I have learned some new information based on the nurse-to-patient ratio. I've learned from my interviews that nursing is not the same as it was years ago. One of the nurses that I interviewed, she has been practicing for 19 years, and she mentioned how patients were not as sick as they are today back then, so the acuity level wasn't as high as it is now. Because of that, there's an increased need for care and attention for patients now than it was back then, although improvement has been made with night shift staffing. Years ago, staffing on night shift was a lot more, maybe about like 8 patients to a nurse. Now it's the same as day shift, between 5 to 6. Next is that staffing is an issue everywhere. I interviewed another nurse who's an international nurse. He's practiced in the United States, the Philippines, Abu Dhabi, and Ireland, and he mentioned that the ratio in the Philippines was 1 to 8, sometimes more, just depending on the day. Next I have is that California is the only state to have a safe patient ratio law, and I found that very surprising, and that the fact that this law was introduced in 2004 and still standing, and to be the only state still standing, is very surprising. This law mandates all healthcare to enhance a strict ratio to provide patient care. Recommendations. Staffing standards and acts within the hospitals. It recognizes registered nurses' difficult situations with too many patients, which then leads to poor care. The bill helps remove external pressure and allows patient and nurse to benefit from safer ratios. Next is make your voice be heard. Speak up about making a change. And you can make a change by becoming an active member on a state nursing association, gaining understanding of the legislative process, discussing ratios and staffing with nurse leaders and colleagues on your floor, and document situations that illustrate challenges nurses face with patient care. That will make a difference. Also, it will help bills become laws, will not only help nurses with effective practice, but also make better patient care, avoid complications, and a faster recovery. Lastly, I have is the California Staffing Ratio Law. This law regulates a required minimum nurse-to-patient ratio to be maintained on units at all times. The ratio varies from unit to unit based on acuity, and nurses have time to prioritize tasks and properly provide patient care all throughout the shift. Staffing is still an issue and remains a hot recurrent topic locally and globally. Although 14 states have introduced some form of legislation mandating nurse-to-patient ratio, for example, Massachusetts is following California's law, but still in the practice, but they are on the way of doing the same thing. Healthcare professions must understand how staffing ratios affect the patient care, and that with patients and voicing concerns, eventually the staffing ratio will be changed. Thank you.